they didn't stop my blood thinners. More about this later, which surprised me because if anything major had happened and I had a bad bleed, could have bled to death. The argument is, which I fully understand, if I didn't have it's not a blood thinner. I don't know why people call it that. It's an anticoagulant, and I'll talk about this a bit later on. But it basically stops your blood clotting, which, if you're bleeding to death, clotting is a good thing. One of the reasons, well, the main reason you take an anticoagulant is that if your heart is in fibrillation, it can form a blood clot because it's basically foaming, and it can get trapped in the heart or one of the chambers of the heart. And if it does that, you could end up with a blood clot, which can give you a stroke or a heart attack, particularly if it travels to the brain. I mean, you're dead. That's the choice that you have. You can either bleed to death, or you can have a stroke or a heart attack and suffer the consequences of that. So, tough decision. Either way, not good. They decided in their wisdom, which is probably the right decision, even in my humble opinion, because my heart was in fibrillation all the time they were trying to do the procedure. And I found out at a later point that they actually had to zap me with the old paddles, you know, what they often do if your heart stops, because my heart was fibrillating so much they couldn't actually do the procedure. So I had to be zapped to get my heart back into rhythm long enough for them to do the procedure. I was actually in the ward for another day after this procedure. Some people they let go home straight away. I was still getting bouts of fibrillation and tachycardia after this procedure. They did point out that it can take up to a month or maybe 6 weeks before you're completely stable. So I thought, okay, that's fine. But over the first night that I was in the hospital still, I had several bouts of really quite bad tachycardia again. To my surprise, in the morning, they said, "Oh, you're okay now, you can go home." And up to this stage, I hadn't even got out of bed. All of a sudden, it's sort of, "Oh well, you can go now." I was a bit taken back because I started to get myself ready and I went along to the toilet, and I thought I was going to pass out again because when I came back, I still had the little meter on me and I was well in tachycardia again. I thought they're letting me go out and I'm almost the same as when I came in, but not as bad, if that makes sense. But I was still getting heart rates of over 100, which made me feel unwell. There's 12 people waiting to get in your bed. My wife picked me up in the car because I wasn't allowed to drive for the foreseeable future. Prior to actually leaving the hospital, I was given a medicine update, and one of them was this. It stops excess acid in your stomach. Now, I was a bit surprised why I would be prescribed this particular medicine, because it's not really got anything to do with the procedure that I'm aware of. I stand to be corrected on any of these points, by the way, if you know better. And so I was given a prescription, and here some of them are. For 30. There was no explanation given as to why, and why 30? Does it mean I take the 30 and then I don't take any more after that? I didn't really know because I didn't know why I was given the prescription to start with. The other thing I was given was Pradaxa. and that is the anticoagulant or blood thinners if you prefer. And that's what I'd been on prior to the procedure. And I understand what that's for, and I understand why I need it. Theoretically, you only need it if you have fibrillation, stroke, tachycardia. And eventually, should that be cured categorically, I won't need that anymore, but otherwise I will, because you've only got to get one bout of tachycardia, and that's the bout that actually gives you a blood clot and kills you. So people tend to be on it forever, if not longer. I wasn't surprised, and I understand why I was still given Pradaxa. Makes sense. What's going to happen about my sotalol, which is basically the other medication I was taking, which was actually giving me the low BP and bradycardia. And he said, oh, you can stop that. You don't need that. You don't need that. I was a bit surprised because on the bottle that it comes in, or the container, it says on there, do not stop taking this medicine. Some medicines, like that kind of medicine, you have to ramp down on them slowly. In other words, have a half a tablet for so many days, maybe a quarter or whatever. But he just said, no, stop it. And on the day of my operation was the last time I ever took that particular medicine. Okay, so I went home, and I'd only been home probably 2 to 3 hours, and all of a sudden I had the most blinding headache ever. If someone said what's the highest rating of a headache of say 10, it rated at about 9, and I'd never had a headache like it. All of a sudden my tachycardia went through the roof. I can't remember what the numbers were now because I wasn't in a fit state to remember it, but it was a figure that I'd never seen before. And I started to get visual disturbances. I was seeing like a 3D image of gearing going round in ultra high definition. I mean, some people would have paid a lot of money or taken a lot of drugs for this. It frightened me, it really did. And not only that, I was beginning to get tunnel vision. My eyesight, instead of being sort of infinitely wide, was going like this. And in the end, I could only see pinholes of this machine going round. And my heart rate had gone up to 200 over 100. And I thought, oh, call the ambulance quick. Something's gone very wrong with this procedure. The ambulance were here within 7 minutes. And I mean, St. John's Ambulance in this country gets 10 out of 10 from me. My experiences of them have been excellent. Anyway, I told them what had happened, or my wife told them, because I was barely conscious and really frightened. I really was. I thought something really bad was happening. I told them about the tablets, and they, oh, he said, this is the St. John's guy. He said, oh, you mustn't just stop taking those just like that. And I said, well, that's what I was told to do. So that's what I did. I mean, he's the big G's and I'm just the patient. And he said, well, we can get you out of that. And he went to phone his superior. That's a horrible word because he's probably not superior, he's just higher rank. They have on board a tablet of something. If I can find out what it was, I'll print it here. But he said, this is a quick acting whatever it was. Take this and within 15 minutes you'll be okay. And I thought, okay, that sounds brilliant. And I said, I don't need to go to the hospital. And they said, no, because all they'll do is the same as what we're going to do, except we're going to have to drive you there, and it's going to take 30 minutes to get there. And we don't know what the consequences will be, or even the consequences will be if you're in that high a BP and with that amount of tachycardia, particularly with your visual disturbances. We think we should do it now. And they had me connected up to all the kit here, just on the chair in the other room. And I was very impressed, and within a very short space of time, probably 10 minutes or so, I started to come round. The visual disturbances started to go away within half an hour, and they were here all this time looking after me. I mean, that's better service than I've had from my GP and the hospital. So full marks to St John. Great people, very knowledgeable. And I said, well, this is fine. I'm now out of it. But as it's now Friday evening, what do I do? Because the ambulance guy says they're not allowed to prescribe anything. They can give me medicine on the spot, but they can't prescribe. And I thought, well, yeah, I understand that. I said, well, what can I do? Because the surgery at the GP is now closed on Friday night. They're not going to be working Saturday or Sunday. So I've got to wait for Monday before I can get any medication. I said, well, I do have the previous medicine that I used to take, which is, I said, can I just continue with that until I get to the GP? And again, they talked to their big G's, and they said, yeah, just continue with what you used to take until you know any difference. That's what I did. I couldn't get to see the GP for 10 days, so I was on my medication for 10 days. And now, of course, I'm back to where I was with bradycardia, low heartbeat, dizzy and all that. And I just had to put up with it, because they wouldn't want me back at the hospital, because they don't see outpatients sort of like that. You have to book an appointment, and it's months before they see you. I finally get to the GP, tell him what had happened. And I said, well, I can't stay on this medicine because I'm going to be, as I am now, bradycardia again. And I said, can I cut down the amount on the medicine? He said, well, that you're already on the lowest dose. And I said, well, can I take half of it? Can I cut the tablet in half? Because it has score marks on it. And he says, well, I don't really know, because it's not a recognised dose. That's what I would do if I was going to stop taking this, is what the doctor at the hospital recommended. So, do I do this? And he said, well, yeah, okay, cut it down to half. I've been on half ever since, but I'm still getting bradycardia to a lesser extent, but I'm now getting missed heartbeats. About every third or fourth heartbeat, as you can see here, I miss a beat. So the overall effect of that is, instead of having 60 beats per minute, in real terms, I'm only getting 50. So I'm suffering the consequences of that now. After a bit of research, I find the reason I may have had all that problem with the vision and things like that is because I stopped taking the medication just like that. And apparently what the medication does, it inhibits adrenaline, if I've got this right, forgive me if I haven't, from so much of it going to the heart, and that's what slows it down. So if you stop taking it, all of a sudden you get an enormous rush of adrenaline, which the heart does not like, and it does what it did. So that's what I think if there's any medical people out there that know better than that. But that is a foreseeable result of a rush of adrenaline. And that's why you have to gradually cut it down if you're about to stop taking it. What makes me cross is that I was told to do this by a cardiology doctor. Oh, just stop it. Just like that. Not ramp it down or do something else. So I was left, when I left the hospital, with no actual medication for the purpose that that tablet was designed for. To this day, I still haven't got that result. We're pretty much up to date now, but I have one long-term unresolved problem. That is, I can sometimes have good numbers, i.e. ECG and also blood pressure, and yet all of a sudden I will come over in a sort of, it's fairly hard to explain, but a completely drained feeling. I feel hot and sweaty, but not to touch. This is internally, I feel like this. And I come over with complete and total fatigue. My legs feel like jelly, like I just want to collapse into a heap on the floor. I feel slightly nauseous, very weak and tired, and completely lethargic for no measurable reason that I can give. I think it could possibly be the medication that I'm on. As I explained previously, I'm on Pradaxa, which is an anticoagulant, which I can't really do anything about. It's one of those things that until any tachycardia is completely resolved, which I think is probably unlikely. I have to say at this stage though that the procedure that I had, the ablation, I think I can honestly say has been successful. I've not had any major issues now for some weeks. I know some weeks isn't very long to judge such a treatment, but I'm optimistic that that has been a successful procedure. So that's good. But I still have these periods that I'm describing now when, needless to say, by the way, now is not one of them. I'm feeling reasonably good today, hence making this video. But I've tried making the first part of this video. It took me 3 days to record for basically a 30-minute video. And it's not because I'm slow, it's because I had to find periods of relative coherence to actually make and edit the video. Anyway, I digress. Armed with this problem that affects me most days, to be honest, if it was just once a week or once a fortnight, I could live with it. But it's most days that I have periods that last from anything from half an hour to all day. I decided, appointments with the hospital are months and months apart, and I'm still waiting for my next appointment, and even as I make this video, we're talking of 6 weeks away. Back to the GP. I phone them up, and of course I can't get an appointment for 2 weeks, which is normal these days, and to make things worse, my normal GP isn't available because he's doing whatever else he has to do. Rather than wait for 3 weeks, I accept an appointment with another GP that I haven't seen before. I go to see him, tell him much the story that I've just told you in the last 5 minutes, and he said, "Oh, it sounds like iron deficiency." And I said, "Well, again, you're the expert, I'm the patient, but I did point out that probably a month ago I had iron studies done." And he said, The ones you had were just a very basic test, and I will go into a much more comprehensive test and test all sorts of things to do with iron and such related things. And so, okay, so I went next door to the bloodletting thing, and the leeches were let loose. I got the results the same day through the internet, and I looked at the results and all looked good. The studies actually show you a minimum and a maximum of any particular parameter, and to be fair, I was on the low side of the minimum, but not out of what is considered normal. So providing you're within that range, then to me I don't see an issue. The very next day I got an email. Well, actually I didn't get one, I had to go and dig it out from the doctor, and this is his reply. And I was completely taken back by the reply, because it's not what I expected. Bearing in mind, I went to the GP for help. I gave him the symptoms and the problems, and he did this blood test, which came back negative. So to me, the next thing is, we've checked that, now we have to check this. And these are the following tests we need to do. To get a reply as he did, saying, I hope I feel better. Well, of course I don't feel bloody better. That's why I came to the GP in the first place. And he goes on to say, if anything else, I want to go ahead with anything else, go to my GP. And I thought, you are the GP that I've been to, and you've basically tested something and then saying, well, I don't know anything else. That's $50, please. And to me, that is completely and totally unacceptable. But this is what you have to put up with. I've spent thousands of dollars with my GP, and I haven't yet had this problem resolved. The hospital isn't resolving it, so what do I do? I just don't know where to go from here. I mean, the GP is the first call. He will then write to the hospital and say, oh, this Mike has this and this problem, and then 6 months later I get an appointment to go to the hospital, which sometimes it's fruitful, like the ablation. That's worked very well, but I'm still left with bradycardia, irregular heartbeat, missed beats, and this fatigue syndrome that I've discussed with you. To me, it could well be due to the medication of the beta blocker, in other words, the sotalol. I still don't know, because I haven't received any information from the hospital or my GP whether I can stop taking it without, on a ramp down, or whether I have to take it. I can't take this on myself because I could make things worse. I don't know where to go. The hospital is completely unhelpful on this matter. The GP largely do what you want, if you want to cut it in half, well, do that. Anyway, on a final point before I wrap up this video, hopefully it'll be the last part, but as you can see, my medical life is somewhat hectic. The thing that I wanted to tell you about is the beta blocker that I'm on, known in New Zealand as sotalol. And basically most beta blockers are similar. So you would expect within reason, the side effects, which are truly horrific, I have to say. And it may be that the issues that I'm facing is because of this sotalol. But as I can't get any further information or help from either the hospital or the GP, I just don't know. These are some of the side effects, and if you look it up on the internet, there's a huge list of side effects. And the funny thing is, you get a list of, 10% of people get this, 5% could get this, and 1% might get these. And you'll be not surprised to hear that all of my symptoms fall upon the 1% or less, which I personally think is grossly underrepresented, because I know half a dozen people, and I know you could say half a dozen people out of the millions that are on these medications is not a true representation. I have to say these are people that are on a similar medication, including family members, some of which have actually stopped taking the medicine because of side effects, but all report at least some of these side effects. And it's really, I know all medications have side effects, but when it suggests that 80% of people have little or no side effects that go away after a few weeks, I just find that almost fantasy that that can be the case. These are the side effects that I personally experience, and they're all largely in the less than 1%. So I'm either just lucky or what. Forgive me for reading this off my list, because the list is quite extensive. Fatigue, dizziness, slow heart rate, shortness of breath, nausea. I get all of those most of the time. Now, one of the things that upsets me most is rapid weight gain. I've been more or less the same weight now for the last 25 years, but since I've been on this medication, I have really put on a huge amount of weight in a very short space of time. And ironically, it's not because it gives you a greater appetite and you want to eat lots of pies and chocolate. It's the opposite in many respects. I find food now tasteless, and I'm quite happy to eat just a bowl of cornflakes or Rice Krispies or something like that, and I can't face a full meal. If anything, I now eat less than what I used to eat, and yet I've gained a considerable amount of weight. Now, granted, you can't see basically because it's around my chest. I don't know if I want to show. Well, you don't know what I looked like before because you've only ever seen me from there on videos. But take my word for it, I've put on a lot of weight, even to the extent of my arms. I mean, it's just something that I hate, as I'm not basically a fat person. And being diabetic, I don't eat, to say I don't eat any chocolate would be a porky pie. And mind you, I don't eat porky pies either. Anyway, I'm sorry, I digress. The other issues can be blurred vision, yes. Sensitive to light, yes. I go outside and for the first time in my life I have to use sunglasses, which I've never used ever. Chest pain, I get assorted pains around my chest, not specifically where my heart is, but just an unwell feeling of various pains and things like that, which again, in the past, I've never had. Now to talk about Pradaxa. This is a medication which I've talked about before, but also has a great big list of side effects, of which the minimal ones that only 1% of the population gets, I'm right in there. The main things that this offers is numbness and tingling, which I get in my hands and arms. It's very hard to explain, but it's like a cold hotness, if that can make any sort of sense. There's just not enough words in the English dictionary to describe the feeling that you get from it. Cold hands is just permanent now and really annoying. Muscle weakness, again, I haven't lost strength. I can still crush a grape. I don't have the strength or the stamina to do work, basically. Sour acid stomach. Yes, get that. Heartburn. The worst, or one of the worst ones, is itchy and flaky skin. It's a bit like dandruff, but without dandruff. It's just that if I feel my head here, it's rough and it's very easy for skin to flake on my ankles and feet. Head. Cough for no apparent reason. It's like I've had flu for the last 6 months. It produces I don't want to freak everybody out here, but first thing in the morning, coughing phlegm, but it's not infected phlegm. You know, if you have a bad cold, it can be green or other horrible colours we best don't want to think about. But this is just like a clear gel that is just something that happens, which has never happened before, and it's part of the cough. I'm not a smoker. I've never been a smoker. It's just side effects of the stuff. Tiredness and weakness, yes, well, that's just part of the past. Anyway, whether I shall make a part 3 on this subject will depend if any of you kind folks actually watch this one. Because I don't think it's going to be one of those videos that's going to make me millions of dollars in revenue. I'll be lucky if I make a cup of coffee out of it. Anyway, that's the end of this part anyway. Thank you so much for watching, or even watching. I do appreciate it, and goodbye for now. Take care. Bye-bye.